If you've experienced pelvic pain, you know how uncomfortable and limiting it can be. My name's Christine. I'm a doctor of physical therapy and a specialist in pelvic health. I treat men and women every day who suffer from chronic pelvic pain. In today's video, we're going to go over some exercises that can help you find some relief. Let's start by talking about anatomy a little. Your pelvic floor muscles attach from your pubic bone all the way to your tailbone. We have 3 different layers, one covering the front, one in the middle, and one deeper inside. There's a lot of reasons why you might be experiencing pelvic pain, but when we've been in pain for a long time, these muscles tend to tense up and make it even harder to relax. So today is going to be all about relaxing. So for the first exercise, we're just going to start with deep belly breathing. You could grab a yoga block or a pillow or something and put it under your hips. So we're going to lie down, put this under our hips, and the focus here is going to be deep belly breaths. As you inhale, I want you to imagine your 2 sit bones separating from each other. So you can breathe in this position. You could have your legs in butterfly and breathe. Or you could even hold them in happy baby. Whatever works best for you. I'm going to opt for butterfly position. And we'll do this for about a minute. Your other option is to put your feet against the wall and breathe in this position. So you want your legs to be able to be heavy and relaxed. If you can't do it, maybe elevate them on a couch instead. You're going to be lying down. You could have your arms out to your side or on your stomach, whatever's more comfortable. And we're going to do some trunk rotations. So your shoulders stay on the floor and your lower body moves from one side to the other. And you'll feel a nice stretch in your low back. Make sure you're breathing as you're doing this. I like to hold for a couple seconds when I get to each side. From here, we're going to do a piriformis stretch. So you'll cross one leg over the other and bring your knee to your chest, holding at the back of your thigh. If you can't do that, you can always grab a towel and put it around your leg and hold it there. This is one way to do it. The other way I really like to do this stretch so I can feel it deeper is to grab my hand and get the back of my foot or my ankle. And I just hold it like this and you really feel a deeper stretch. We're going to hold this for about a minute. And let's switch. So do it whatever way you feel most comfortable and that feels like a good stretch to you. If this is too much, then do it like this, or you can bring your foot to the ground and just stretch this way. So you have a few options here. Here, we're going to go into a deep squat. So you'll be in a deep squat here, taking deep belly breaths. You can hold it, or you can alternate bringing one knee in and bringing it out, then do the other side. You can also hold it and shift from one side to the other. So for the next one, we're going to be sitting like this, and we're going to go from one side to the other, trying to get some hip mobility in. You can make this a little harder by lifting this back leg, trying to bring the foot up, hold it for a couple seconds, and then put it back down. That's really hard for me to do today. I'm really tight, so I'm gonna not do it. But if it's comfortable, you can go ahead and do it. So you'd be here, you lift your foot up, and then put it back down. So my right side's a lot tighter than my left. Let's go into a hip flexor stretch. So you'll start by kneeling on the floor. You'll put your hands next to that front foot, and you're gonna rotate and open up. You can hold that, or you can go in and out of it. I prefer to hold it just because it feels like a better stretch for me and really dig deep into that hip. Last stretch. You're going to be kneeling. You'll bring one foot out and lean your hips back into it. And you'll feel a stretch right over here. We'll hold that for about a minute on each side. And we'll switch sides. I hope that helped. Remember that this is just part of the larger program to manage your pelvic pain. Other things you can do are making sure you're walking consistently, managing your stress, eating healthy, and getting 7 to 9 hours of sleep each night. To learn more, follow along.